The hearing today is basically continuing our work to confront COVID-19 and to hear from governors about what more the federal government can and should be doing to help in our nation's response. It's essential that we unite to combat this virus so that we can save lives, protect communities, and safely reopen our economy. And the only way that we're going to do that is through a coordinated national strategy that increases testing and dedicates sufficient resources to contact tracing, surveillance, and containment. Unfortunately, President Trump continues to refuse to put in place a national strategy for moving forward. And it's just the latest example, in my opinion, of the president's failures to properly recognize the crisis that we face. At first, the president scoffed at those who were raising alarm about COVID-19 and insisted the virus would go away. And then as the threat became more undeniable, he refused any responsibility. And for months, he has failed to develop and implement a national testing program with clear goals and plans for achieving them. And this failure of leadership at the national level has forced states to fend for themselves, oftentimes competing against each other on the open market for critical tests, personal protective equipment, ventilators, and other resources they need to fight this virus. And states are essentially bidding against each other, which drives up prices for the resources that will continue to be needed in the weeks and months ahead. And this is not the way to combat a national public health crisis. And of course, being in New Jersey, which is one of the hardest hit states, I'm particularly concerned about this, but I care about it for the whole country. The president continues, in my opinion, to abdicate his responsibility. So House Democrats took bold action last month by passing the HEROES Act. This legislation provides critical healthcare resources that are needed, including up to $75 billion in grants to support robust testing, contact tracing, surveillance, and containment activities. The HEROES Act also finally requires the Trump administration to develop comprehensive and coordinated strategies for testing, contact tracing, and surveillance, and provides greater transparency in real time around supplies, testing, and infection rates. And the HEROES Act requires clear benchmarks and timelines and brings public accountability to this entire process. And we also, in the HEROES Act, shore up our public health infrastructure by replenishing much-needed medical supplies, modernizing how we use the strategic national stockpile, and installing a medical supplies response czar. We also require the administration to provide clear accounting for the work being done now in preparation for the manufacturing and distribution of a future vaccine, and identify what more must be done to ensure that the vaccine can be swiftly available to all who need it. The HEROES Act also puts in place clear guidelines for how an additional $100 billion in resources for the Provider Relief Fund should be distributed, and ensures those resources are allocated to our hospitals and frontline healthcare providers in an equitable and efficient way. Now, because of the governors, I also want to mention that the HEROES Act supports states' Medicaid programs by increasing the federal matching assistance percentage, or FMAP, by 14 percentage points, and increases federal payments for Medicaid services for patients in home and community-based care. And this is critical to states that are facing dire financial situations as a result of the pandemic, and it allows them to continue providing essential health care services. Now, governors, I haven't mentioned, of course, the fact that we have direct aid for states and municipalities in the HEROES Act as well. That's not in our jurisdiction, but obviously very important. And it ensures that all COVID-19 treatment is free without cost sharing for all Americans, so that nobody has to worry about the cost of getting treatment or vaccines. So, we had that in the CARES Act, that the testing was free. Now the treatment and the vaccine would be free as well. Obviously, I think the Senate should act on this, because we're not going to be able to beat this virus without the HEROES Act efforts in place. So I just wanted to welcome the three governors who have all faced challenges in responding to this public health threat. As the committee continues its oversight under Chairwoman DeGette and considers further legislative action, it's important for us to hear from the governors on what's working, what isn't working, and what more they need, either from the federal government or from Congress. And I know you guys are on the front line. I know how important it is for us to help the governors in the states, and certainly our committee will be fully cognizant as we proceed. So thank you again, Diana.